Hello,
Hi,
my name is Sujan and I'll be your provider today. Can you tell me your name?
Rushan,
Can you tell me your birthday?
June 29, 2012.
Okay, alright. By the way, we're also recording this video and then I'm gonna submit this or upload this in the YouTube for my instructor to review. Is that okay with you? Is that okay with you?
Yes.
Okay. By the way, I'm also asking legal guardian for the consent to upload this video in YouTube and submit to the university for educational purposes, who is also recording the video at this moment. Is that okay with you?
Yeah, no problem.
All right. so, Usan, today we're gonna be checking your heart. Okay.
Okay.
All right. We're not gonna be asking you a lot of questions. We're just gonna do check your heart. And go from there. All right. Okay. So to check your heart, would you mind taking your top shirt off? All right. Thank you. Okay. All right. And then if you can lie down this way for me. There you go. Thank you. Also, because we don't have the way to raise his level of head, we're just gonna use a pillow and assume that he's at 30 degrees. Okay. All right, so first what I would do is I would check his blood pressure in both his arms, lying down supine, and then I'll check his blood pressure again, sitting up, and compare them for the measurement. After I'm done with my blood pressure, I would use this manual cuff to take his blood pressure. After I'm done with his blood pressure, I am checking for his neck. I'm checking for symmetry, which is midline. I'm looking at the trachea, that's midline. And I am going to check for jugular venous pressure at this time, which would be a little bit above the external angle. So at this point, I am checking for the internal jugular vein, and I'm looking for the pulsations at the internal jugular vein. Which I can see his pulsations about a centimeter up from the sternal notch, and I am going to place an angle right here, and I am going to use a measurement to measure directly at perpendicular from the sternal notch. So which gives me about 1 centimeter. So his jugular venous pressure is at 1 centimeter. After JVP, I'm checking for his carotid arteries. I'm checking for pulses. I'm looking for to find if there are any abnormalities. So I would use my fingers to palpate alongside the subclavicular muscle area to find the palpation of carotid artery, which I can feel is brisk. I don't feel any thrills, and it's at +2 amplitude. I would do that on both sides. In the meanwhile, I am also going to auscultate the carotid artery. I am auscultating for any thrills or any brutes. I will use the bell to listen for any brutes. I do not hear any brutes or unusual sounds. After my carotid artery check, I am going to check for the chest symmetry. I am looking for chest wall. I'm looking for the rise and fall with inspiration and expiration, which I see is very symmetrical. I do not see any abnormal movement. I don't see any apical impulses or precordial pulses. After my chest wall visualization, I am going to perform palpation. So to palpate, I will start with the 4 points, epithelium points of the heart, especially PMI, point of maximal impulse, is rather important, which is also found at fifth intercostal space. So if we look at 3, 4, and 5, mid-clavicular line, fifth intercostal space, this is where we can get the PMI. If I could not feel this PMI, I would have my patient turn left. Can you turn left a little bit? There you go. And then feel for the PMI, which would kind of, I would feel it towards the chest wall. I feel the PMI is tapping, which is about 1 centimeter lateral to the mid-clavicular line in the fifth intercostal space. I am also going to pop it for the abdominal aorta, which is right here at the epigastric level, and I am checking for any thrills or any pulsations or any lifts, and I do not feel any of that. So after my palpation, I am going to go for auscultation. So to auscultate, I am using a stethoscope. I will use both bell and diaphragm to auscultate all parts of the heart and abdominal aorta. So we'll start with the diaphragm. So I am auscultating at around second intercostal space on the right hand side, which I'm auscultating for aortic valve. Similarly, same thing, second intercostal muscle, space, I'm listening for pulmonic. I'm listening 1/3 to 4th intercostal space. I'm looking for listening to Irv's point. 5th intercostal space, I am listening to tricuspid valve, and lateral to that 5th intercostal, I am listening to the mitral valve. So this is also the apex of the heart, which is where the heart sound is really distinct. S1 especially is really distinct at the apex, while at the base, S2 is more distinct. Upon auscultation, I can hear crisp S1 and S2 sounds. Now I'm going to use the bell on same points to auscultate for any broods or thrills or any murmurs. Also, I'm auscultating for physiological splitting of S2 sounds. That usually happens, which I don't hear. That usually happens when there's a slight delay in closure of the valves of pulmonic valve and the aortic valves, the mitral valves. Usually on inspiration you can hear that splitting of sounds, because during inspiration your heart has more time to fill in the blood on the right side and increased duration, so that increases time for the closure of the valve on the right hand side. That causes a physiological split of S2 sounds. Also, I am going to listen to aorta, both diaphragm and bale. I am listening for any broods or murmurs, and I do not hear anything. Also, a part of the cardiac exam would be palpating or listening to the iliac, the renal arteries on both sides and iliac arteries on both sides. But we are not going to do that today. Now, after my checking of auscultating the heart, I am going to check the peripheral, which basically includes the extremities. So I'm inspecting first and looking for any skin rashes or any lumps or any abnormal findings in both his extremities, or any edema. I don't see any edema or any rashes or any skin tear. I'm also feeling for warmth. I'm looking for the color. So all these extremities are really warm, and the color is appropriate to ethnicity. I don't see any cyanosis. I am also checking for any clubbing or cyanosis in his nail beds. I'm looking for cap refill, and his capillary refill is less than a second in all his extremities. Okay, I don't see any clubbing in any fingers. I do not see any varicose vein or spider web. I don't see any of that. I am also going to be checking for the pulses. So I will start with the radial pulse on both hands, which is brisk and amplitude of +2. I'm checking for brachial pulse, brisk amplitude of +2. That is on both sides, brisk amplitude of +2. I'm checking for femoral pulse, which is right over here near inguinal area, which is also I can feel brisk and +2 amplitude. After my femoral pulses, I'm checking for popliteal pulse, which I would use both hands to locate the artery good for the pulses, which is also brisk and +2. I do that on both sides. I'm checking for the dorsalis pedis pulse, which is right at the anterior foot, and I can feel the pulse. That's also brisk and +2. And I am going to check for the posterior tibia pulse, which is located right underside the foot, and that is also brisk and +2. I don't see any cyanosis, any hemorrhages. I think that pretty much concludes our cardiovascular test. Thank you, son, for joining, and you can put your shirt back on, and thank you for recording.
Thanks.